Oh, here we go.
Okay.
We're live. Hey, everybody. I'm here this evening with Dr. Dodd. She's one of my favorite people. We met actually. She came in and did a branding session with me a couple of years ago now. When I think she was first launching your pharmacy advocate business. And the moment I met this woman and her energy and her heart, we connected. And we've become friends since. And when I was thinking about who to bring on and have conversations with in line with health and choosing health and really learning how to listen to our bodies, she was one of the first that came to mind. So I'm very excited for everyone to hear from Miss Dr. Dodd herself. So I would love you to just kind of share a little bit about your passion, like how you got started, and why you took and created your pharmacy advocate. I'll just give you the floor.
All right. Well, thank you. And as Tessa said, I am Jerika Dodd, and I'm a pharmacist of 22 years now. Gosh, that seems like a long time. And I spent the majority of my career, 17 years exactly, in the pharmaceutical industry. And in 2018, because of my health, I had to make some really big choices about how I would make my living and what would that mean for me. But in 2015, I think it all started to shape up for me in that I began to support and advocate for my parents. In 2015, that Father's Day weekend, as a matter of fact, the Friday before Father's Day, my father was diagnosed with stage 4 lymphoma. He is a Vietnam veteran and was potentially exposed to Agent Orange. And I remember sitting in the doctor's office with him, getting that diagnosis, and he, like, what do you say to that? Like, what questions do you have in that moment? And I just remember, like, kind of going into pharmacist mode, if you will, like, okay, what are we going to do? Not daughter mode, but pharmacist mode. And then it was, doctor's appointments and trips to the doctor where I was asking about the chemo that was going to be administered, the radiation that he was going through, all of these things that I remember thinking to myself that if I wasn't there, I don't know that he would know to ask those questions. And so it was 5 months later that my sister called me and said, Mom's on the way to the hospital with chest pain. And 3 hospitals later, she ended up having triple bypass heart surgery. And that in and of itself was magnanimous. However, she came out of that surgery and my sister and I kept thinking, if only this anesthesia would wear off. But what we realized was that the anesthesia had worn off. But my mom came out of that surgery with the best that I can describe was like a dementia. And I remember instantly becoming an advocate for my mom because I'm standing in the hospital and I'm saying, hey, can we get a psych consult? Something's wrong, because everyone was just kind of going about their way and doing their job duty. But my mom was not the same mom. It's like she went in as my mother for surgery and she came out like my grandmother. And so we had bouts of that dementia where she didn't even know my name. She didn't recognize me. And if you can imagine not being prepared, no one ever said, no, this is what it could be like when she comes out of surgery. No one ever did that. And so I found myself being an advocate, from going to doctor and psychiatrist visits, talking about specifically the medication, from standing in the nursing home and saying, or the skilled living facility where she went for kind of a rehabilitation period after her surgery. I remember standing there and saying, she is not well enough to go home, but because her insurance said she was done, she should be out, they were sending her out of the facility. And so I remember having to be an advocate then. And then 5 months after my mother, as if it had not already been enough with my dad and my mom, I had brain surgery. Yeah. And I found myself being an advocate. Not that I didn't get great care, but I found myself being an advocate for myself, asking a lot of questions, and of the doctors and the nurses that cared for me while I was in recovering from surgery twice, if you will. And so from there, I remember the second time that the back of my head was open, I said to my dad, after the surgery, when I get better, I'm going to build something to help patients. Because by this time I'd seen my dad, my mom, and her experience, and myself, and how, I advocated for all of us and our health. And I just remember thinking, not everyone has a pharmacist in their immediate family that can do that for them.
Right. Absolutely. So what did you learn in the process of advocating? Like, what were things that you saw maybe as holes or possibilities weren't being?
Patients don't know what questions to ask. And when patients don't know what questions to ask, I believe that it leaves them at the mercy of whatever information they do or don't get. I think about like my father, and I think I was in shock a bit as well, getting that news that Friday before Father's Day. But even the way it was delivered, and it was kind of like, you have cancer. Okay, come back on Monday and we'll talk about it more. And it was like, well, who does that? So if you can imagine what that Father's Day was like, I mean, my head was spinning like, oh my God, is this the last Father's Day? I didn't know, at the time, how serious, stage 4 is bone marrow involvement for lymphoma. So I knew that we had a serious case, and not that all cases are not serious, but I knew it was more serious in the degree of involvement. But so the first thing I would say is, like, that's not cool to get that kind of news on a Friday and then come back and agonize all over the weekend and come back on Monday. I think about, my mom and how, like I said, I was the one that said, can we get a psych consult? No one ever, like, it just seemed like everybody was business as usual. And I'm going, wait, there's something wrong. But I don't even really remember, like, who did we talk to? Who was it? I remember, asking for help from a social worker. And it just so happened the social worker at the hospital in the ICU was my aunt on my father's side of the family. And so she knew us. And so she was trying to help as much as she could with giving me facilities that I could go and review and see if that was a place that I would want my mom to be. And very, very stressful. And so I remember, and it's actually the header on my LinkedIn page, where I say everyone needs a pharmacist at some point in their life, whether it's, understanding what's going on with regard to medications and getting the right dose and making sure that the patient's questions are answered. Yeah, that's probably the biggest thing. I feel that every patient needs an advocate, and I believe that every patient needs a pharmacist everyone needs a pharmacist at some point in their life.
Yeah, because at some point we all get sick, regardless of how much we do to, maintain our health and prevent sickness, like sickness comes. And so at some point we've all probably taken some sort of antibiotic or prescription or drug. And so
even if I get sick, but I say you need a pharmacist to stay well.
Yes. So tell me more.
I just believe that our healthcare system, unfortunately, does not necessarily, in my opinion, truly promote prevention. It's set up for sick care. It's set up when you're sick, then we can help you. And I believe in our country, the understanding is implied that you can eat what you want to eat. You can, consume alcohol as much as you like. You don't have to work out. You can even smoke and vape and whatever you want to do, however you want to live. And when you get sick, we can help you. We've got pills for that. And if we don't have pills yet, Alzheimer's, we're working on one. But why are we not doing more to address the standard American diet that we eat? Because Alzheimer's starts in our gut, doesn't start here. And so I believe that, yes, a pharmacist can definitely help you when you're sick, but I think a pharmacist can also support you to stay well and while you're well.
Yeah, so I totally agree. So a lot of people that watch this that know me personally or have followed me know that I fought and battled, well, it ended up being 7 years, or about 6 or 7 years of chronic illness but that grew over time, and going to the doctor and stuff and doing blood work and seeing a general physician like didn't give me answers. Saying I felt these things and had all these symptoms, they were like, well, everything on paper checks out, you're fine. So then I felt like the crazy person. And so being an advocate, whether you have someone in the hospital, is so important. I've seen that with family members, but also like being an advocate for yourself. And I think trusting me and what I know I'm feeling, and not letting them, not taking no for an answer per se.
Yeah.
And in my own journey, I learned quickly, and have learned even more of the last 2 years, of the gut health. And nobody has ever mentioned the importance of gut health. And so I would love you to speak a little bit more to that, because I have walked and experienced just how much of those symptoms was really tied back. It was being caused by inflammation in the body, but then it was tied to gut stuff. And so what do you mean when we say gut health? What does that entail?
I would say that most of America has a gut health problem, and it's likely due to the standard American diet, if you will, which is processed food, fried food, not how we should be eating. And our stomachs, unfortunately, really aren't made for the standard American diet, which is high in fat, high in sodium, high in sugar. Like, it's just, we're not made to eat that way. And so, and obviously you can have a whole separate conversation on food and the quality of the food that we eat. But because most people, I think about the fact that the merry-go-round of the world, for several reasons, has slowed down, and people are at home and they're cooking and they're eating hopefully better food than when we're on the run and we run through a drive-through or we pick up something at the gas station convenience store. I'm hoping that that lends to better gut health for people, because what happens is that standard American diet that we ingest over and over and over again, and our stomachs are not meant to eat that. What happens is, we develop I'm trying to think like the best way to simplify it.
Yeah.
Is we develop holes, if you will, almost like cheesecloth. And if your stomach were lined with cheesecloth, I'm trying to give an analogy, and there were some holes in that cheesecloth. And so when the contents of what you ate landed in your stomach and it didn't have a chance to digest because there were holes in the cheesecloth, so bits and pieces of food would escape through those holes and end up in your body. And your body goes, hey, that's foreign, because it hasn't had a chance to break it down so that we can get the nutrients from it. So you wonder, like, why would someone be allergic to tomatoes, or why? Because, and it's potentially because little pieces of food that have not gotten digested break off and go through the holes in the barrier in our stomach lining, if you will. And then now we're allergic because our body recognizes that and goes, wait, that's foreign. That's not supposed to be here. And then it responds. And then over time, eating that standard American diet lends to just inflammation, period, if you will. Yeah. So then we're walking around with inflamed bodies, inflamed guts. And unfortunately, we're very adaptable. And what's not normal or abnormal, if you will, we can easily adapt to that. And we just go, oh, I just have a little bloating. Oh, I have a little reflux disease. Never mind the fat, the caffeine, the spicy foods that lend to all of that. So we just kind of adapt, and we keep eating what we like because it tastes good. Salt, fat, and sugar taste wonderful, and everybody likes them. And then over time, we're ill, we're sick. And so chronic disease sets in. We get hypertension, we get diabetes. We ultimately end up with Alzheimer's, which is one of the chronic diseases on the list of chronic diseases that can impact people. And so I would say that a big portion of the disease that we face as a country for chronic illness comes from our diets.
Yeah. Yeah, interesting, right?
Yeah, and then there's the conversation of, you know, like, when you hear people say, and for some people that's what they can get. So then there's a whole nother conversation about socioeconomics and why is it that people in lower socioeconomic groups are only have a McDonald's or a establishment such as that in their neighborhood. Why don't they have access to fruits and vegetables and things that are sustaining of good health? So why do those things happen? Again, that's a branch off of another conversation. However, when you look at the price that you pay for food, and this is, gosh, I don't want the McDonald's people after me. I mean, fill in the blank, whatever food place. But when you look at what you pay for food, and they had to make a profit also off of what you bought, it doesn't cost them a lot, and so the quality is not necessarily there. And so, but then can everybody afford to pay for better food? Or, so there are a lot of factors that are mixed in there that have to be considered.
Yeah.
And I'm talking about type 2. I see somebody put a comment. Yes, type 2 diabetes. Type 1 diabetes is a different concern. But as a result of the standard American diet, adult onset is actually what it's called. Adult onset diabetes is a result a lot of times of the diet.
Of the gut and the gut health. I listened to a great podcast, and you would probably know the guy's name because he studied gut health for 20 years. But everything you said, like the cheesecloth was a great analogy, because the lining of your gut too is like massive. I think it's the size of a tennis court or something, he said. Like it's this really massive lining that's just in a very condensed area if it was all to be spread out. But how important it is, and how most diseases, these chronic diseases, are tied to the gut issues and our food and our health. And so if someone's so gut health leads to inflammation, which, initial experience of inflammation is like upset stomach, reflux. Acid reflux, bloating, eventually like bowel stuff, but then also like tiredness, fatigue. I think hormonal anxiety and stress feed that, because stress feeds inflammation in your body. And so they kind of all just start like catapulting together, like snowballing. Yeah.
Then your hormones get involved,
right?
Because your stress, that hikes those adrenal glands into action, that fight or flight. And when we stay in that fight or flight a long time, because we live in heightened, stressful times that don't, it's not like the stress is there and then it goes away. But when we live in that, we talked about that kind of go, 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 go.
Yeah.
That keeps us in that fight or flight mode. And then now we have our adrenal glands that are secreting cortisol. We start packing weight around the middle. And then all of your hormones, as I was saying, are just like this. So when one hormone starts to be out of order, out of range, if you will, the others generally follow suit. And so it just becomes like a cascade. And it's unfortunately believed that as you get older, you will become ill. As you get older, you will gain weight. As you get older, you can expect that this is just...
It's like normalized.
Yes.
Yeah. So what are simple, I guess, because if I'm, I make up that someone might be hearing this and being like, oh my gosh, like I totally eat the American diet. I'm bloated. I feel awful. But like what you're telling me is like, I need to give up everything I like. Like I like my sugar. I like my carbs. I like my sweet corn. I mean, it's sweet corn season right now. So, and corn and butter are sometimes, corn can also be inflammatory. I experienced that personally. And so, and everything, like I found myself, I mean, I eliminated gluten, dairy, sugar, like all the things that are typical, alcohol, wine. And then I went and saw the nutritionist, who I'll be talking to later this week, and identified that, rice was a massive one for my body, a block. And like rice is in everything that's gluten-free. And so it's really interesting that even if we're choosing these foods that we believe are good for us because of marketing, like gluten-free is better. Well, it's better, but it doesn't mean that it's like
the
it's
best for
going to
you.
work, or actually best for you. Exactly. And so where does someone start?
I think some of the first things you can do. So it's a difficult thing, but really, I think to really know, you can obviously have testing done, and they can come back and tell you everything that you're allergic to, which will make you go, "What? I can't eat anything," or you can follow, which can be a challenge because it basically takes everything away. So it's hard to know what the problem is it's like if you're eating everything but we don't know, is it corn or is it the gluten? And so an elimination diet helps you kind of strip everything away and then give your body a chance to rest, to heal. And then over time, you start to add things back one at a time. So if you've stripped most everything away, of course, your palate will not likely like it, because as you said, we're looking for salt, fat, and sugar, because that definitely helps us to deal with whatever it is we maybe don't deal with in the best way. And so that stripping everything away, adding it back one at a time, is a good way that when you're adding things back and you add back corn, for example, you go, "Ooh, I don't feel so good." Okay, well, what was different? I ate corn. But if you ate corn, you ate a lot of other offending things, it's really hard to go, well, which one was it? And so that is, and there are, different degrees, if you will, of eliminating things from your diet. But some of the things that you can start with: dairy, gluten, sugar, processed foods, and for all of those for differing reasons. And I think it depends. Like I told you earlier that I had a patient who was complaining about a lot of sinus problems. And I was like, okay, well, what's your dairy intake look like? And she goes, oh, I love cheese. Yikes. Well, milk and cheese can be, that may be offensive to your body. And the thing is we're all different. And so what may not bother you may bother me. And so I think that you have to you start taking things away. And I know for me, when I take sugar, like the first couple of weeks of the pandemic, I was like, I think I had this, oh, I'm home, comfort food. This is new. And didn't even realize that I was picking all this stuff up when I went to the grocery store. But when I cut that out, I was like, okay, I've lost my mind and I will be like 15 pounds heavier when this is all over. Cannot do that. So literally when I cut out, like there's no sugar in my house. There's no, and if there is, I'd have to bake it, and God knows I'm not going to do that. So I feel like my joints feel better.
Yeah.
Things like that. And you start to notice, you go, oh, I don't have that problem. I don't feel that anymore. So that's what I feel that you have to do with the diet, is basically get really focused and do some semblance of an elimination diet where you're pulling out the things that could potentially be offensive to the body, and then slowly adding them back and determining, how do I feel when I consume that?
Yeah, I think that's a really great way to explain it and start, because it's you're learning how to also pay attention to your body. Like your body, when you don't feel good, is giving you feedback as to like, hey, something's wrong here. And so I think in our culture, or in our medicine, our westernized medicine, we've been trained or told that like, if you have a headache, like take Tylenol. If you have an upset stomach, pop a Pepsid, Tums, whatever. Like if there's a symptom, there's like a drug for it to eliminate ease the symptom, right? But you're not you're never getting to the root cause. And so when you like quick fix, like it's a quick fix. So we're fixing and then we're out of discomfort, and then we're not really paying attention or checking in with ourselves to say, I wonder what caused the discomfort. It's like, oh, I'm just going to continue to indulge and ignore my body and just pop just take care of the side effect, or not the side effect, but a pill. The symptom. Yeah. I'm just going to cover the symptom. It's like a Band-Aid on a wound that's gushing blood. Like it's not going to do a whole lot.
No.
Um,
One of the things that, for example, when I work with diabetic patients, one of the things that I encourage them to do is when they're monitoring their blood sugar in the morning before they have their breakfast and look at what that reading is and
mhm.
instantly go back to what did you have for dinner? How late did you eat dinner? Because it gives us information, as you said,
Yeah.
even measurements like blood pressure and blood sugar give us information like, is your blood pressure higher in the morning? Is it higher in the afternoon? Maybe because you've been at work half the day and it's stressful. You know,
Right.
like, how do you take the information based upon how you're feeling, based upon the readings that you're getting that you're able to
Mhm.
take? How do you feel? What are those measurements? And then what does that look like? Like I said, for the diabetic patient taking that morning glucose level, what did you eat yesterday evening? How
Yeah.
much? How late?
It's
Those are the clues.
right clues, and then you can like use that to gauge like to just like to I guess have a better understanding of what works for your body, what doesn't work. And I think the
Mhm.
other thing is too, like at least when I first started like elimination diet or like pulling stuff out, it felt like I was going to have to like well there for a while I felt so much better once I eliminated everything, but then I also was like I don't want this like strict diet to be the rest of my life. So then I got to make the decision to go a step farther and remove what was causing the inflammation or what I thought was causing. There was no proof that it was until it was removed. And so and then still even after the surgery and removing the point of inflammation and what was making me sick, like the root cause of that,
Mhm.
like my body then still needed to heal. And so that's been a really interesting year or 14 months. And I feel like I'm just getting to the point where like the corn I'm eating this summer has a much different, like I feel fine eating corn now versus like last summer, I could still feel like the, inflammation or like it still kind of made my stomach upset because my gut, I mean, I don't know this scientifically, but what I understand it to be would be that my gut at that point was still there was still inflammation in my body and it was still healing. So I'm still in the point of healing. And now, um, like over time, I'm able to eat things that I couldn't eat before. And it doesn't mean that you have to give it up forever. It's really just to give your body the rest
To
and to
heal.
really learn to listen to your body. And once your gut's healthy, then you can actually go and not only enjoy how these things taste, but then you don't pay the side effect, like the
Right.
prices afterwards either.
The other thing that it's important to do is to also rotate our foods. So
Hmm.
if we think about fruit and vegetables, they are in season at different times.
Yes.
And so it's not like you don't want to only eat one of anything. Like, so, don't eat broccoli every day. Broccoli's good for you, but don't eat it every day. Rotate, eat other vegetables. Don't eat spinach every day. That can be problematic. Don't eat Brussels sprouts every day. That can become
Yeah.
problematic. And so I'm a firm believer that the bounty that we have of fruit and vegetables available during all seasons of the year, it's
Yeah.
very important to eat a variety of foods, because I think that's another thing that our systems need is variety. And
Mhm.
because different things offer different vitamins and minerals. And so we don't want to only eat one thing. We don't want to only eat, we need to have as varied of a plate as
Mhm.
possible versus, like I said, don't eat spinach every day. Don't eat broccoli every day. Vary it up. Get some other greens, get some other vegetables, get some other fruit. Don't eat strawberries only. Eat
And you mean
strawberries.
like the case of peaches on my counter? I should probably spread those out.
Yeah. And so, those are things to consider, is that we have a rainbow, if you will,
Yeah.
fruit and vegetables that we can eat. So we should eat the rainbow.
Yeah. I think eat the rainbow. That's a good, like, just a easy, like, remember or thing to
Remember,
remember. What are real, as we wrap this up, because I want people to be able to watch it and address it and take something away from it, but not have to spend forever listening. So, I mean, I like us, but so like, what about in this time of like, I mean, COVID's still a thing. I know, when I first talked about this and we, my husband and I traveled for 2 months in the face of COVID. Like it became a thing at the end of our first week of travel. And like just our choices played such a big part, I believe, in the fact that we were able to stay healthy, not just like avoiding getting COVID, but also just not getting sick in general. and spending so much time on planes and in public space places and things. And so what are some things that people can do as we step back out into, work picks back up, school's going back this fall? Like, how can we prepare our bodies, whether it be the foods we eat or don't eat, or things we can choose to do that we may not be hearing in the news, or they may not be telling us, sharing openly, like things that we can actually do to protect ourselves besides wearing a mask and gloves?
So one of the things that I think is very important, and I talked about this at one point, someplace in my group, was I talked about developing a mindset of I'm going to be in charge of my health.
Yeah.
I think that is because your mindset is going to impact the way that you approach your behaviors, your actions. It's your mindset. And so I think that you want to, have a mindset of I'm going to get through this. I'm going to survive this, whatever this however long this pandemic lasts. And then I think it's really important to think about the cases where you may be where you're around other people. So one of the things that I think that people don't really understand is virus transmission. And so I was reading an article that talked about being in enclosed spaces with a large number of people. Generally, naturally, if we're not at the movie theater, it's loud when you're in large spaces. And I'm not saying that the movie theater is exempt, because there are lots of people there generally. But when you're in places where there are lots of people, they tend to talk louder, because if everybody's talking, think about when you go to a restaurant. Think about when you're in a place and it's closed in and there are lots of people, everybody's trying to be heard. So we tend to talk louder. One of the things that is known is that the louder you talk, the more respiratory droplets you expel. And so consider things like that, and consider, I'm not saying wash your hands to death, because, that I believe can lead to, other challenges. But make sure that you wash your hands. Make sure that you keep your hands out of your face. That's really important, not to have your hands near the orifices of your face, your eyes, your nose, your mouth, and making sure to abide or try to understand, and if you are going to wear a mask and gloves, that you do them properly. So I see people all the time with mask and gloves that they might as well not have it, either because you're wearing it improperly, either because if you're constantly touching that mask with these gloves, then now these gloves could potentially be contaminated. So I think it's really important to, if you are going to use protective gear, that you consider how, because we're a lot of times we don't even think about it. I've been to fast food restaurants and I'm in the drive-thru and I'm like, well, are we wearing masks or not? Like, what are we doing? And so those are things that I think that you just have to be more thoughtful about your actions. A lot of times we do things and we move about and we're not thinking about what we're doing. We're not thinking every time, I've just touched my glasses and, brought my hands close to my face. And so just as easily as I touch my glasses, I could reach behind them and rub my eye, and we don't think about what we're doing. So I think it's important to think about what you're doing. If you're using protective coverings and protective gear, personal protective equipment, use it properly, learn how to use it properly. I think it's really important to support your immune system.
So what are ways, that we can support and not compromise our immune systems? Like
stress is a really big one. And as you can see, the news is constantly has a feed for us, whether it's digital, whether it's by TV, there's constant news. And you want to make sure that you don't feed yourself a constant diet of bad news. Like literally, you could stay glued to the TV for hours, and that can be stressful because it's not like you turn away and once you finish watching TV, all that just goes away and you don't think about it. And so that is one thing that I would say You want to make sure to not have a constant diet of news and stressful events, if you will. I think it's important to make sure that you get enough rest. Not getting enough rest can definitely impact your immune system. I think it's also important that you make sure that your body is hydrated. That's important as well. And then we talked about diet, up until this point, but making sure that you're getting lots of fruit and vegetables. Well, and I won't say more vegetables, if you will. I don't want to go on a fruit binge because the sugar content. But nonetheless, making sure that you're eating well, because eating that standard American diet, as we talked about, definitely impact your immune system. We talked about how and your gut health.
Right.
And so making sure that you're eating well, making sure that you are resting, making sure you're hydrated. Simple things, making sure that you're exercising. Exercise is
movement. Yeah.
To your immune system.
Yeah, strong body and lungs. And I think that the diet too, like I know when I first started hearing about this in January and we were talking about it, just avoiding inflammatory things, because sickness in general in your body is inflammatory, but then I don't know what we know of COVID now versus then, but it's it gets in your body and it's inflammatory in the lungs and it's causing additional inflammatory or inflammation. And so like, what can I do for us? And for me, it was like, what can I do to like remove, I guess, and isolate the inflammation in my body, because then it's in a better position to fight if and when I do get sick, and not to focus on the fear of getting sick.
Yes, no.
Right. Because if I fear getting sick, like, I'm likely going to get sick because I'm stressing about it. So it was like, well, if you get sick, then and then we'll just deal with it when it comes. But I'm not going to live. Yes, I'm not going to live in the future of this fear of being sick and worst case scenario, right, ending up in the hospital or what have you. And so I believe, from my experience, anyways, that's been very important. So I love that you touched mindset as the number one. And and to ask yourself, like, I'm feeling fear. What is it? Is it true? Like, walk out the worst case scenario. Like, don't be afraid of it, because so many times our brains make out to be these little bitty fears become massive, and they're not realistic if we just are willing to face them. And to face our fear. And then are we choosing fear? Because watching the news or reading the news and worrying and like, is it feeding this fear and anxiety in my body, or is it actually giving me freedom? Is a great question to ask. This is my coach side. And so
I have when I'm coaching my clients, I say, so then what? So I have a fear of, okay, so let's say that happens, and then what? What? So then what will you do? So then how will you
respond? Play it all the way out.
Right. And usually by the time you get to the end, it's not this big giant, fear that we've made it out to be in our mind.
Yeah. The reality is so much like less than the fear. And if it is something that like may happen, like then you can prepare for it, right? I can choose now so that I'll be ready then. But I'm not going to I'm not going to live into it to bring it to be. So mindset is so important. I think that speaks really powerfully, not just to, health and body immunity, but to lives in general right now in the state of the nation and society and culture, like just to really be cognizant of our mindset and what we're believing and questioning what we're being told, not being afraid to ask questions. And to really how can you be an advocate? Well, you ask questions. And I think that is actually a really powerful, just not to be afraid to ask questions. Like sometimes when I ask questions, I'm afraid that I'm going to look silly. I'm going to be stupid. Like it's the wrong question. It's a dumb question. And yet what if it's more damaging that I just didn't even ask? And
I would agree.
Yeah. So, well, thank you so much. I think I took a few notes so I can bullet point this. Share it. And so is there anything else you'd like to share or say?
I would say that it's really important to make sure that your health is one of your top priorities. And that is because oftentimes we don't consider our health as a priority. We say it is, but we don't really have the actions to support
Mm-hmm.
that. And so it's important that your health be a top priority in your life. And if you don't know what you need in order for your health to be your top priority or for your health to be better, then I encourage that you find someone, and like you said, ask
Yeah.
questions, educate yourself, find someone that can be an advocate for you. And I also feel that when you make your health your top priority, then you're able to, that's like one less thing that you're worrying about, because
Mm-hmm.
if you don't have your health, you don't have much at all. And
Yeah.
so whatever it is that you are aiming to do in life or in business, if you don't have your health, that's going to be very challenging. And
Yeah.
so it's very important for your health to be your responsibility,
Mm-hmm.
because it cannot be the responsibility of your spouse, your adult children, or
Mm-hmm.
even your doctor. It needs to
Mm-hmm.
be your responsibility and your priority. And when it becomes your priority, you will ask the questions. You will ask the hard questions. Why do I have to take this? How long do I have to take this? Is there another alternative? Because your priority is to have what's best for you.
Yeah, I think that's powerful. It's so true. I love that. Taking responsibility for your health. And I think that goes in line too with what, as we discussed this evening, like making what choices can I make now to put me in the best possible, like to take care of my health rather than just waiting until I'm sick and then somebody's going to take care of me, or, we'll see the doctor and they'll treat the symptom. So it all ties together in the circle. But if you would just choose our health is wealth.
Yes, and I believe that when you heard, you were saying earlier that you got to a point where nobody could figure out what was going on, and I've been at that point prior to my surgery myself, and I would also say that not to give up, because
Mm-hmm.
you may go to doctor after doctor after doctor and everybody shrugs their shoulders, but at the end of the day, it's your health,
Yeah.
and that just may not be the person that is able to help you answer your questions or answer the question of what's going on.
Right.
Keep searching. And I know that it can be tiring and it can be frustrating, especially when you're tired of not feeling well.
Yeah.
But I would say, if at all possible, don't settle with, well, I guess this is just going to be the way it is.
It is
Keep
the way it is.
looking.
There's other sources.
Yeah, keep
Yeah.
looking.
Yeah. And sometimes you need to look out. Like for me, I just looked outside of traditional medicine and oh no, sorry. I looked outside of traditional medicine, like the testing for whether it be allergies or food stuff, or, there's other resources out there when we start to ask the questions and do the searching or just talking to friends and family. There's so many ways that we can find answers. It just starts with asking.
Yes.
So I think, that's almost number one takeaway is not being afraid to ask questions and to speak up. So, all right, cool. Well, thank you so much for hanging out this evening. I really enjoyed the conversation, and I love you dearly and appreciate you sharing your wisdom with everyone. So I will, if anyone has questions, I will post this on Facebook, and then I'm going to send it out as an email as well with a link to it. And then I will make sure that your contact information is there. So if they have questions for you or they can follow up with you, we'll keep the conversation going.
Yes. Thank
Okay,
you for having me.
awesome. You're welcome. We'll see you.
Okay.
Bye.
Bye.